in December because I was terrified I would get sick and I would get my father or my wife or one of my patients sick. In May, I'm telling you, vaccinate so we can get back to normal life. We all want to get to barbecues and parties and to travel. If we go back to regular life without vaccines, we're guaranteed to get COVID. These vaccines are amazingly safe. COVID is not. So get vaccinated so we can start the best summer ever.
I got vaccinated for the people who can't.
I got vaccinated because I want to be part of the solution. I love Mendocino County, and I want us to be able to live our lives again and build stronger communities.
I got vaccinated because I believe in science. I want to protect my community, my patients, and my family. I want to do my part for others, for children who should be in school, for frontline workers who we so depend on, and for the millions of people worldwide who lost their lives to COVID this last year.
I got vaccinated because my children can't get vaccinated.
Because I love my family and I love my community.
To see my mom. It was her birthday coming up, and so I just wanted to be safe and protect her.
To take care of my health and the health of those that I love.
I felt it was the right thing to do. My parents are in their 90s. My husband teaches children. I'm active in my community.
Not only to protect myself, but for my ohana too.
Because it's the only way to stop the spread of coronavirus.
So please get vaccinated.
And one. All right, hello and welcome everyone to the Friday update with Mendocino County Public Health. My name is Cameron Brown, and as always, we're very happy to have our health officer, Dr. Andy Coren, here with us today. We'll get the latest COVID updates and as well as some other public health updates from him. We'll jump into taking questions from local news media, and then finally, we'll also look for questions on Facebook from any members of the public for Dr. Coren. So let's jump in, and Dr. Coren, I'll hand it over to you for updates.
Thank you. Well, welcome everybody. It's been a year since the blueprint ended, if you remember that far back, and we continue to learn about this pandemic and how to live with its challenges. If we can go to that first slide, we can see how things have changed over the last year. Across the top, you can see each of the surges that we've experienced since the summer of 2020 and what the peaks were in deaths, hospitalizations, admissions, ICU patients, and average cases per day. It's a nice composite that our state epidemiologists put through just to put us in perspective. So right now we're in the midst of this wave or surge. If you look on the right, that's it. You'll see under the June 10th, June 13th current, we are running about 101 cases, and that was a 4-day period from 6/10 to 6/13. It's about 25 cases per day. But if you look back at the other surges, the Omicron surge back in February was 261. Delta was 145. And in a year ago, we had, and it was not during a surge, we had 19 cases. And then you can look also at the winter surge in 2020, which was our record, 713 cases, and those are per day. Hospitalizations, similarly, we're concerned about the hospitalizations at 2,762. But if you, let me get this out of the way so I can see better. But if you look at how high these hospitalizations were, even with Omicron, it was 15,000. These are state numbers also. The Delta surge was 8,300. And the winter surge before that, in the winter of 2020, 2021, 21,938. If you go down a little bit, the same thing is true with ICU patients, much less, and the 7-day average cases are now 16,000 for the state, whereas they were up to 122,000 during the Omicron surge as a peak. The Delta was 13,000, and the winter surge 2020 to 2021 was 45,000. So these case rates, hospitalization rates, we're clearly seeing a wave, but this is not like it was in the prior surges, and that's a good thing. And now also, since the blueprint has closed and a lot of the orders have gone out, really the only general requirements for the public now are indoor masks in certain high-risk settings like hospitals, long-term care, corrections, and shelters. So our vaccinations and treatments and our masking and distancing have really had a very significant effect. The current COVID wave of increasing cases and hospitalizations is now due to this highly contagious BA2.12.1 and continues to be the highest in terms of its effect in the Bay Area. To understand this, the state forecasters are looking at experiences in other countries, other states, and in particular New York, which has led us by about a month during this wave. It looks like the increase in our cases is slowing to form a shoulder in the upward curve now, just as New York did about a month ago. The hospital admissions in New York also seems to have peaked, and similarly, California admissions seems to be slowing down, but not quite at a peak. At the same time, California seems to be experiencing even less hospitalizations than New York had. Can we go to the next slide? What confounds this is that new variants, BA4 and BA5, which is in the, I guess that's a turquoise down in the lower right, that's growing. And those are the new variants that are coming in. They're split about 50-50, but they're expecting the BA5 to be a little bit more contagious and will probably outnumber the BA4s. And they are beginning to impinge on the percentage. These are genome sequence proportions here. So red is the BA2.12.1. The BA2 in the lighter pink above that seems to be shrinking. And again, like I said, the BA4 and 5 are growing, and we expect those to be growing as well. We're trying to learn about that from the Texas and Minnesota experiences, where they have higher rates in the range of 30% of their sequences are BA4/5, whereas California is now about 22%. And the next slide, please. The projection now, because of this, is showing that we'll probably see a peak in cases in early July and hospitalizations in late July, with a long, slow tapering of cases and hospitalizations thereafter, because the BA4 and BA5 have so far shown no increase in their virulence. And then the next slide shows how rural California, Rural Association of Northern California Counties is the red line. And on the left, we were a little bit higher back in May, and we've come down now to the California average and are actually, this is the left graph in terms of test positivity. And we're at the lowest except for Southern California, that has even less testing positivity. Again, the test positivity is less reliable now than it was a year ago, because we have so many people testing with the at-home over-the-counter tests that are not reported. But if you look over on the right, again, the case rate, because for the same reasons, is not quite as reliable, but Rancho is right down at the bottom. The rural, Northern California rural counties, which we're part of, is at the bottom of this graph of cases. So if we go to the, oh no, we don't have another slide that I want to show, but I'm going to move over here. In Mendocino County, our daily new cases actually increased by a factor of 10, 1,000% in the last 10 weeks. It's now at about 32 cases per 100,000 per day, but it seems to be stabilized at that. That puts us in the red or high transmission zone for the CDC transmission risk. And testing positivity now is 11.9% for our county, compared to the state's 10%. Again, these are with all of the uncertainties because of decreased testing and more testing at home. The schools have had no cases reported recently. Graduations were outdoors. It's been about a week, and we haven't had a rush of new cases from school-age people. We're expecting a robust summer of school programs that are planned for academic catch-up and social activities. And students with have been sent home with tests and instructions to prepare for their return, whether they're going to summer school or later on in the later summer when they start the regular season. And there are more available if they need it, and if they go to events during the week, they can certainly get more through their schools. Outbreaks are now 4 in our county, and these are in congregate care areas, and we've had 3 already closed earlier this week. In the hospital, it doubled last week with 9 Mendocino County residents in our hospitals. But as of yesterday, we only had 3 Mendocino residents in our hospitals, and we have someone here from out of town. The person that we had who was hospitalized from our county down in Santa Rosa has been able to be discharged. And today, the CDC moved Mendocino County from high to medium community risk because of this decrease in hospitalizations. So you can see here that our regional hospitalization statistics also puts the Rancho counties toward the bottom in terms of the weekly admissions per 100,000. And we're seeing that here in Mendocino County as well, which is a good sign. Our bed availability is not stressed by COVID patients, though every COVID patient that there is in the hospital requires more work and more staff to care for them because of the need for personal protective equipment. Nationally, the hospitalizations increased 20% week over week in early July, but that seems to have plateaued out now. And the total deaths in the United States, you probably read, were exceeding 1 million on May 24th. Mendocino County hasn't really changed since then. We're still at 125 of our people have passed on due to COVID. Testing is continuing at the OptumServe sites with more antigen tests now. And also there are free over-the-counter home tests available through federal government, as well as community-based organizations, the schools, and the health departments. Treatment, there's a slide I think that you had, Cam, for this. Oral treatments are now also available for people who test positive and have mild to moderate symptoms. They start that within the first 5 days. It's like a usual antibiotic that you would take for a bacterial infection, or there are antibiotics for things like herpes. And so this is very similar, but it needs to start within the first 5 days to be effective. And we know that these are being underutilized. So if you are testing yourselves positive at home or you're having symptoms, please call your provider and ask if you are eligible for those over-the-counter medicines now. The one that we're having the most success with and is very available is Paxlovid. There are test to treat sites that Optum serve here in Ukiah and also down in Hopland can take advantage of. If your test there with an antigen test is positive, they will have a nurse take a brief history and then connect to a provider. And if you're qualified and eligible, then the provider can call in a prescription, or it doesn't have to be called in. The Optum Serve sites actually have the Paxlovid with them. As far as vaccines go, remember that while we have been discussing immune escape on these viruses and waning of immunity in time, statewide data shows that they're still very effective compared to not being vaccinated. So unvaccinated people have 5.6 times higher case rates than the people who are vaccinated. Unvaccinated people are hospitalized at a rate 8.9 times more than the unvaccinated, and the unvaccinated people unfortunately pass away 10.9 times the rate than those who are vaccinated. And on the next slide, we're going to look at all of the different surges through the past year. And you'll see the red line is deaths, and the purple line is cases, yellow is hospital, and the black line is ICU. What's interesting as you go along is when you get to, it's actually the last vertical red line, when 70% of the population was vaccinated in September. Since then, even though we had the peak of Omicron in purple, that next purple peak, the red deaths and the yellow hospitalizations proportionally fell much less than they were in prior peaks. And now during this current COVID BA 12.2.1, you can see the purple line of cases is a wave. It's not as huge a peak as it was for the big Omicron one, but look at the red and yellow and black lines are almost at the bottom. They're not totally at the bottom, but you'd have to expand that to really see where they are. And that's because we have developed immunity in our community from the vaccines and also from illness. And we're learning how to treat our patients better, but we're also all learning the value of being masked and social distancing. So currently in Mendocino County, our vaccination rates have very slowly increased. The vaccines are available through public health at the fairgrounds in Hopland, and we are continuing to go out as needed to visit care homes to make the vaccines available to all who want them. Other locations for vaccines are through the clinics and many pharmacies. And as of this week, 75% of our eligible population were fully vaccinated. This does not include the federal data, which is vaccines that were given by VA or Department of Defense or through the Indian Health Service. 57.5% of eligible residents were also boosted, which is now recommended for everyone over 5 years old. And the second booster is recommended for everybody over 50 years old and those who have underlying conditions that make them more vulnerable. Unvaccinated people still account for 17%. And these percentages are going to change when the infant toddler vaccines become available in the next couple of weeks, because the denominator will change. And so the percentages of people vaccinated will go down as the numbers eligible go up a little bit. So what's new in vaccines? As I mentioned already, boosters are now recommended for children between 5 and 11 years of age. There is a new vaccine type that has received emergency use authorization called Novovax, and that is an American-made protein-based non-mRNA vaccine. And we feel that that's going to be helpful to bring in some people who've been hesitant about the newer technology, mRNA vaccine, and hopefully more and more people will get vaccinated with this Novovax vaccine when it is available. It's been around and been used in many other countries for many months, but at this point, the United States does not have any contracts to pay for them. So we're awaiting that to happen as well. The biggest news is that infant toddler vaccines for children between 6 months and 5 years old has been approved for Pfizer and Moderna, and it'll go through its usual committee recommendations. ACIP still has to weigh in. The Western States review also looks at it, and then CDPH looks at it. But the vaccines are already in our community, and I think ready to be started to be pushed out on the 21st when there's demand. Let me see. So why would we want to vaccinate children with a lower mortality rate in the United States? Let me just go through a few of the issues here. Almost 75% of children have actually been infected. They show many, many fewer symptoms, and so a lot of that was unknown, how infective it was until they did some serology tests of children throughout the United States. 75% or 13 have been infected, and 13 million children have actually been symptomatic with COVID. That is 19% of all of our COVID cases. 15,000 children have been hospitalized. 180 children have died. The unvaccinated children are hospitalized at a rate twice as much as the vaccinated. And 1 in 5 children who have been hospitalized needed ICU care. Half of the hospitalized, this comes up as a question, half of the hospitalized had no underlying conditions whatsoever. And remember, it's in this age group that multi-system inflammatory syndrome can affect with very bad outcomes. And it already in California has affected 960 cases, resulting in 80 deaths. Long COVID is another concern that we have. We're just learning about that in adults, but we do know it's a neurological condition, and they've even been able to show on MRI scans that there is some thinning of the outer layer of the brain in certain areas. And so we're very concerned about, as we learn the effect of long COVID in children, that it may not be even as limited as it is in adults, but go on to affect their schooling and their futures. So long COVID is a concern. Also, vaccination in this age group, of course, protects others, and some of them may be the more vulnerable family members. And then finally, if you're vaccinated, you have less illness. Less illness is less school missed, less recreational events missed, and other social events and family events that are missed. So these are important to pass to our community and make sure that they get vaccinated and get their children vaccinated as well as possible. I want to just go briefly through our current recommendations, and then there are a few other topics we'll touch on. The current recommendations, again, with us in the highest risk of transmission, is to stay up to date with vaccines and boosters. And then secondly, remember, indoor masks are strongly recommended for all in public indoor settings. It's also high-risk individuals and families will be protected and may want to wear a higher grade mask. And in those families where there are much more vulnerable people, some of the members of those households at times may want to wear a mask around their more vulnerable family members. Indoor universal masking is also still required, according to the state orders, in hospitals, nursing homes, and other healthcare facilities, corrections institutions, congregate care settings, including all shelters. And a word about gathering, keep them small, keep them outdoors. And if indoors, open the windows or the doors, use fans blowing outward to improve ventilation. And if you're going to a gathering, test before and stay home if it's positive or if you're sick. And if you do have new COVID symptoms, even if they're mild or a positive test, call your provider for treatment to start within 5 days of symptoms if you're eligible. There are no changes in the Mendocino orders or the state orders for isolation or quarantine. If you're sick with COVID, it is still a 10-day isolation period, but with the option to test out after a negative test at 5 or later days. All right, so let's move on to the other infectious disease that we've been hearing about in California and around the states, and that is monkeypox. This is a West African virus that is usually passed from animals to humans, and very occasionally in Africa has passed from human to human, and very occasionally has been found in other countries. But in the recent month, we have seen that starting with travelers, over 1,600 cases in 30 countries have been found, and we're finding that it is spreading person to person through close physical contact with people or with the contaminated objects like clothes or linens. 65 cases have been found in 18 states in the United States and 9 in California. Let me see. Yeah, here we go. It's actually 19 in California, so I'm behind the times already. It usually, but not always, starts with a prodrome, like any virus, with a fever, headache, muscle aches, and sometimes with swollen lymph glands. And then a rash can start usually on the face and moving down, although some have started on the genitalia and some have not followed the rules of the road and they've started lower and moved higher. The rash is typically clear, raised vesicles that then get cloudy and break and scab over. Although it sounds like chickenpox, it's more related to smallpox and has a mortality rate in West Africa of 1%. As with all things, these don't necessarily follow the classic presentations. So we have informed all the providers in our county, and that the effort is throughout the United States, but we've certainly informed the people in our county so they may recognize it and call the health department for further diagnosis. We ask that anybody with a new unusual rash or swollen glands go to your provider for a thorough exam, and if needed, there's treatment and there is prevention for close contacts. And moving on then, we'd like to talk a little bit about infant formula. And so I was going to start this off with on a lighter note, and there's some improvement, and that's true, although in a minute I'll tell you why I'm saying a little bit different. The infant formula shortage seems to be resolving generally. This was due initially to a supply chain issue and then compounded by an Abbott manufacturing plant in the Midwest being closed due to contamination. So all the brands of formula were in short supply, and in some communities, Northern California coast and inland was hit the most. The shortage was really quite severe. And this especially affected the most needy people on WIC, those nutritional programs. And it was a problem because they're so restricted in WIC in terms of the paid formulas, the quantities, and the brands. However, the government during this crisis did relax the restrictions on types and quantities of formula and authorized some imports that are being checked for quality, and actually flew in supplies to some areas. Now the manufacturer, well, Abbott started producing, but then was affected by the recent floods in the Midwest, and so they've stopped. But I think we're fairly well geared up that we're not going to see severe shortages. However, I did hear on a call to the clinics this afternoon that in Willits and Point Arena, they are having significant problems, and we've asked the other clinic areas to let us know. CDPH is willing to make some special deliveries of formula if it's needed in some communities. The advice that's been given is if your formula is not available or your child's formula is not available, is to make a change. And there are resources here online where to go to find baby formula, and also how to make safe changes. Mixing your own formula is not safe. and diluting formula is very unsafe and has led to severe illness, including infant seizures. So we are working on that. And the last thing today that I want to review is the terrible history that we have recently of fentanyl and narcotic deaths here in Mendocino County. As you can see, they've more than doubled between 2020 and 2021. And 2022 also looks like it's going to be a severe problem in our county. Compared to the rest of the state, we have twice as many deaths and overdose. And so it is a problem that's true all over, but it's especially true in Mendocino County. And this is after the rates have dropped, as you can see, in earlier years. You see, it looks like a buildup, but actually the numbers of overdoses had come down the 5 years before 2020, and the numbers of prescriptions have really decreased through the work and education of our providers. But in 2020 and 2021, fentanyl was beginning to be imported, and it's now being used to cut a lot of the other drugs, and people are taking unknowingly taking amounts of it that can kill them. So this Friday, not today, but next Friday, there's going to be a conference at the fairground, and that is for those who want more information. And so we hope that whoever's out here and listening will attend that. We're trying to develop some strategies to stop this terrible epidemic in our community. So just as a summary for COVID, we're in a wave at this point of Omicron. It is highly contagious, and it's being overtaken by a new, even more contagious variant, or two of them, BA4 and BA5. This does not seem to be causing as many hospitalizations and deaths as prior surges, but it is expected to peak in late July and trail off through August. Yet there is still a mortal risk to our more vulnerable citizens. So everyone masking indoors is highly recommended in public places. And remember to get all your vaccinations and boosters to avoid illness and to enjoy the summer. And with that, I'll close, and we'll be here for questions.
All right, thank you, Dr. Coren. So let's check in with our local news media. We'll go through 3 rounds of questions, if people have that many. And with each round, we'll just go through 1 question per media outlet. Feel free to ask a follow-up if you'd like to clarify. And let's begin with KZYX.
Unmute. Sorry about that.
Yeah.
Hi, it's nice to see you all again. Thanks for being here. I have one clarification and then my first question. You mentioned the Hopland Fairgrounds. Do you mean the Mendocino County Fairgrounds in Ukiah?
For the conference on Friday?
No. You said the test and treat center.
No, we're the OptumServe testing site, which does test and treat, is down in Hopland.
Oh, where is that?
Let's see, is Ann on the line? Can I get some help for the actual location? Have it off the top of my head. So let's see if we can get back on that.
Okay.
Good question. Excellent question.
All right. So the first then question that I had for you is about what I have been told is a twindemic of the flu and COVID at the same time that's happening in our emergency room. Can you talk about that and whether or not you're seeing significant flu and how if you have any numbers on that?
We've been notified that there aren't any flu cases in our nursing homes. That's a report that they're required to make, and the same thing is with the hospitals. So we're not seeing influenza hospitalizations, and I don't have any recent numbers of positive influenza tests. We are advising people to do both influenza and COVID tests, but it depends on the accessibility of those tests.
Great. So no twindemic that you're seeing in the month.
No, it doesn't seem to be at this point. You can save that for possibly the fall when influenza will strike again. This year it was very late, and we were kind of surprised that it extended after April, but it has. And along with COVID, we were very concerned about, this twindemic.
Thank you.
Okay, thank you, KZYX. It looks like we also have Mendocino Action News. So please go ahead if you have a question.
Yeah, this is Danella Sands. Thank you for having this meeting. Very informative. My question is, and maybe you already talked on this, what is the vaccine efficiency rate for children and adults? We used to have that dashboard to look at. So if you could let us know that, it'd be great.
I don't have that at this point. Are you talking about in Mendocino County? Or
Yes.
I don't have that information at this point at all. We do know that there is some waning of immunity as time goes on with this vaccine, and it happens with every vaccine. That's why many vaccines have taken, or require 3, 4, 5 vaccines to be fully immunized, and then a repeat every 10 years, for example, with tetanus. So that's not uncommon, and we're just living through and learning about it. But no, there is some waning immunity. But with the boosters, they come up to the 80s to 90%. So that's why we're pushing people to get boosters and not wait. I didn't mention this in terms of new information about vaccinations, but Moderna and Pfizer are looking at what the new vaccines should be, where they should be targeted, and whether it should be the spike protein, which again is something that's very mutable or changeable, and so we've had issues with that. But the vaccines are still effective, and after the booster, they come back up into the 80%, and then over the next 4 to 5 months, they decrease into probably into the 60%, maybe even 50%. But that's still very effective, and you can see the effect of that in the population and the studies that we showed before.
I think you told me that number was lower for children last time.
I don't know the numbers for the children.
Okay, thank you.
I think it was with the Pfizer vaccine, and that's why they held back on getting their approval, and they made it they didn't change the dose, but they changed the number of doses for the primary series. So Pfizer is now still a very small dose, and they make the doses small so that they have less likelihood of side effects. But it's a small dose that is given every 3 weeks until 3 doses are given. Moderna is a small dose, and it's given twice a month apart. And that's the primary series. Again, we'll have to see what happens in reality to the waning of immunity, and how long or how many it takes to get to an immunity that really sticks significantly.
Okay, thank you, Mendocino Action News. Anne, I just saw you signed on. Did you want to give any input about the Hopland testing site, the test to treat site?
Sure. I just wanted to say that the address is 13101 Nokomis Road in Hopland. And the best place to find all the test to treat sites, which are Ukiah, Fort Bragg, and Hopland, is on the testing page of our website. And the easiest way to get there is www.mendocinocounty.org/COVID testing.
All right, thanks, Anne. So let's get a question from the public via Facebook. The first one is, do the new BA.4 and 5 variants, do they impact at-home testing kits in any way, or their results?
I don't know. The BA.4/5 testing, I don't know if you remember, but when we had BA.2, they were able to identify that because of what they called an S gene dropout. So it was a simplified test that they could do in the lab to identify it, and they didn't need the entire whole genome to test to know what it was. The BA.2.12.1 did not have that S gene dropout. The BA.4 and 5 does again have the S gene dropout. So these are technical aspects of the testing, and I think that even with the S gene dropout, the rapid tests were effective, and I think they should still be effective. It depends on what antigens they're testing for, and my understanding is that they're still effective.
Thanks, Dr. Coren. And let's go for round 2 of media questions. KZYX, you're up.
All right, I'll remember to unmute this time. All right, so we heard this morning that vaccinations have been approved for children as young as 6 months. So can you talk about that and let Mendocino County residents know how and where to get their kids vaccinated?
Yeah, so yeah, I did say something about that. It has been approved. It'll still have to go through ACIP, which is another quality measure organization and the one that organizes vaccines throughout the country. So that'll happen. And then coming over to the West Coast, there's a West Coast States Safety Board that reviews it, which is usually within the same day. And then CDPH will release it with a press release. They are very effective. As I said, the Pfizer requires 3 doses, 3 weeks apart each, and Moderna is 2 doses a month apart. Somebody asked before if I know the efficacy of these yet, and I do not. But we're going to have to live with these vaccines like the others to find out if we need boosters and how long we'll go before we need boosters in that age group. This is the development of a new vaccine, and so there's a learning process that happens. Where they'll be available is through the clinics. So at this point, the little ones we believe are going to be much more comfortable getting vaccines with their own recognizable providers in their clinics in their community, and that's what we are depending upon.
All right, so at this point, public health isn't planning to hold vaccine clinics for kids.
That's correct. We're not going to do we're not going to try and do mass vaccination clinics for children that are 6 months to 5 years old.
And you probably said this, but when do you expect that approval to come to California and Mendocino?
Oh, I think, we have some of the vaccine already available in the county, and the approval is expected within days of when FDA approves it. Usually they get right on board. So I think by the early next week, they will be fully emergency use approved. Okay, so the final approval comes after quite a bit of time and experience, because as you know, even the research involving tens of thousands of people doesn't expose all the potential problems that you find when you're giving it to millions of people. But now, now the 5 to 11-year-olds has been given to tens of millions of children, and it's got a great safety record. We expect the same thing to be true with the infant toddler vaccines.
All right, so people can start making their clinic appointments now?
Absolutely. That's exactly what they should do. Thank you.
All right, thank you.
All right, thanks, KZYX. And how about Mendocino Action News?
Hello again. So my question about OptumServe at the Ukiah Fairgrounds, they're currently doing testing, PCR, rapid, and vaccines certain days of the week. How long do we see that taking place? Is there an end time? Is there a grant that's going to run out? Could you explain a little of
that? My understanding is that the current contract, actually, Ann, you might be able to help me with that, but I believe it runs out towards the end of June, but it is going to be extended, from what I've heard, at least 3 months and possibly 6 months. But Ann, you may know more specifics and more recent stuff.
Well, we'll get some input if Ann jumps back on.
Yeah.
And let's get one question from Facebook again. And this is, do you think the cases will increase in the fall for COVID?
That's an excellent question, and one I don't have the answer to. If the modelers are correct, and we're dealing with BA2.12.1 and BA4 and 5, Hopefully, there will not be an increase in the fall. It will continue to increase now through July and then peak and then start what they've described as a long taper of these variants through August and possibly into September. However, if a new variant comes on board, we don't know how fast it will spread, and we do not know if it'll be more virulent. So the more these things are circulating in the community, the more chance there is for a mutation. And then with mutations, all bets are off. We have to assess how fast or how contagious they are, whether they escape the immunity we've already built up, or the immunity that's given by vaccines, whether they escape the treatments, and how virulent they are, and who will need treatments and who will need hospitalization, and so on. So those characteristics take a little while to suss out. But at this point, it's looking like, the summer is going to continue to be a significant source of infection, hopefully not hospitalization or severe ICU cases for people who don't have underlying disease, and hopefully not a surge in deaths.
Okay, thank you, Dr. Coren. Let's get a final round of questions in, and we want to make sure we give Dr. Coren a little window for his next meeting. So, KZYX.
Hello, this is great. A third round. I love it. I'm wondering who is eligible for Paxlovid when you're talking about people learning that they have COVID through a home test. Who should go and get Paxlovid with a positive home test?
So if you have a positive home test, call your provider. Some providers I know around the state are accepting a self-attestation about the results of their test. Many will want to actually examine a person, but the eligibility for it involves a positive test, at least mild symptoms, and a possibility, an underlying risk where you may be a person who could progress. What the CDPH is seeing is less uptake and less prescriptions by providers, and so the criteria hasn't changed, but they're really encouraging the providers to prescribe more. So again, a positive test, mild to moderate symptoms, of course, not requiring hospitalization, and it's for people over 12 years old. Should have said that.
Oh, okay. So yeah, that was my question. I had heard that Paxlovid was for people over 50 years old, but it's for people over 12 years old?
At this point.
Okay, that's new information. Thank you.
All right, thank you, KZYX. And Mendocino Action News.
Thank you. I don't have a question at this time. I can pass it back to KZYX if they'd like.
Oh, yeah, sure. I've got another question.
Sure, let's get one more.
Thank you, Danila. You talked about free tests being available at a number of sites through the federal government and through public health and through schools. Can you talk about how people can get free home tests?
Well, they can request them at the public health sites. They can request them through their clinics. They can get tested right there. And then I do have a website here if I can find it. Sorry, but there, I think it's vaccines.gov. It's something like that. But you can call in, I think, every month for a couple of tests per person.
Oh, cool.
And get them that way. And then all of the pharmacies that have it, if you're on a health plan, it would be free because they are subsidized by the government. The problem is people who don't have a health plan to pay for it will have to pay. And some of the ones that have a health plan will have to pay up front and can get reimbursed through their insurance company. So the best thing is to get it through the government mail away. And I see you're on the line. Do you remember what the call-in or the URL is for getting your own vaccines?
Yes, it's very complicated. Get your pencils ready. COVID.gov.
That's what it is.
COVID.gov. Well, I'm especially interested though in the getting free home tests from public health. Can you just go?
Well, free home tests from our local public health, you just call our regular straight phone number, 707-472.
759.
Well, yeah, the call center makes the most sense. You're right. And then for the free ones that come in the United States mail, COVID.gov, on the very first homepage of COVID.gov, they give you 4 choices. And one of those choices is testing. Click here to order free tests. And you can't miss it, even if you're not familiar with the internet.
Can you give that phone number again? It got cut off.
The call center is 707-472-2759.
Fabulous. Thank you.
All right, let's get a final question from Facebook. Let me just open it up here. Oh yeah, so can you clarify now in June 2022, what is being fully vaccinated and how many boosters should one get?
So the usual adult, the initial series is 2 vaccines. And then 5 months after that, they would be eligible for a booster. And if they're 50 or above, they could get a second booster months after that. If it's a child, there's between 5 and 11, they get their initial 2-dose series. And then 5 months later, they're eligible for a booster. And for those people who are more vulnerable, their primary series is not 2 doses, but 3 doses. And that 3rd dose can happen a month after their second dose. And then again, 4 months after that, they can get their first booster. And then 4 months after that, their second booster, so their 5th shot. Generally, you're considering up to date in California, 2 doses of their vaccine, their initial vaccines, and then 1 booster. So the second booster is not usually a requirement, though that is what we think is the best protection at this point.
Okay, thank you, Dr. Coren. And I think I'll hand it right back to you for any closing comments you have.
Well, I think we're doing better as a population against this terrible pandemic. And part of that is that we have experienced a lot of the infection, and we've had a lot of people vaccinated, which increases our immunity. And we've learned to behave with masking indoors in public places and social distancing when it's appropriate. But this pandemic is not over, and there are more surprises. And of course, we all want to be done with this and say it's over. Not least of all myself. But reality is, we should still watch our P's and Q's. And if we're indoors in a public place, wear a mask. If you haven't finished all your vaccines, get your vaccines and the boosters, and call in for to schedule the infant and toddler vaccines, and make sure that if you're having a party and scheduling a party during this beautiful weather, that it's outdoors if possible. If you have to have it indoors, make sure that windows and doors are open, because ventilation really decreases the transmissibility. And in the very hot days that we probably will come ahead, we'll not want these A lot of people outside for long periods of time in the hot weather, so indoors would be something to plan for. So indoors, if you're increasing the ventilation, you can do that with your heating air conditioning system or just a fan. But if you're using a fan, blow it out the window so you're not picking up these particulate viruses off the floor. So what I'm saying is that we're at a better stage. We're not done with this. We have been through a terrible 2 years, and we do want people to enjoy this summer, but not let down our guard. We don't want a larger number of cases that can breed new variants and can be a problem up in the future. So we're doing well. Hang in there, make sure you're masking indoors. That's the strongest recommendation that I can give.
Thank you, Dr. Coren. And thanks to everyone else that listened in and asked questions. We'll have our next media day on Friday, July 15th. So we'll stick with our third Friday of the month schedule. And in the meantime, you can check out the public health website or Facebook page for updates. Have a great weekend. Thanks again.